Assalamualaikum, Bismillahirrahmanirrahim. This is Dr. Nabila Shahid, and today we are going to discuss about carpal tunnel syndrome. But let me give you an idea first that what is carpal tunnel. Carpal tunnel is a passage in the wrist which is enclosed by flexor reticulum, which extends from the pisiformis bone and the hook of the hemorrhage to the tubercle of the trapezium. Moreover, it comprises of 10 different tendons which run along this passage, and median nerve is also enclosed in this passage. Now, whenever the median nerve is compressed in this tunnel, it causes median nerve compression, which as a result causes carpal tunnel syndrome. Carpal tunnel syndrome is very much common in the typewriters, are the people who are constantly at offices typing their work. Moreover, it is also caused by the repetitive motion at the wrist joint. Intraoperative compression neuropathy of the median nerve results in CTS, and most common compression neuropathy of the wrist is carpal tunnel syndrome. Here is a pictorial representation of the carpal tunnel syndrome that you can have an idea here that this is median nerve. This is the course along which the median nerve runs to the carpal tunnel. Here are the carpal bones, and this is the normal anatomy of the carpal bones, and it is the cross section of the carpal tunnel syndrome. Here you can have a look at the carpal tunnel, and here is the transverse carpal ligament, and here is the carpal tunnel. Here are the tendons of the shield, and carpal bones are also present here. Whenever the nerve is compressed in the carpal tunnel, the area of pain and numbness can be seen here. And along with this area, the median nerve also supplies the nail beds of these fingers, like half of this finger, the nail bed of the middle finger, the nail bed of the ring finger, the index finger, and the nail bed of the thumb. Whenever a person experiences CTS, the symptoms which are shown or which are described for the patient are the pain, numbness, paresthesia, weakness of the grip and the pinch, edema in the hand and the forearm, atrophy of the thin arm muscles, and symptoms are usually worse at night. Whenever a patient experiences or complains any syndrome, like here we're talking about carpal tunnel syndrome, we always do a test for it to show that whether this disease or disorder is present in him or not. To confirm our diagnosis, we will consider few tests. Here is a Palen test. Palen test is more likely to be done as it has a sensitivity of 85% and specificity of 89%. Here is the pictorial representation of the Palen test that the patient sit or stands with the dorsal aspects of both hands in full contact so that both wrists are maximally flexed. Another test which we can perform is the Tyndall's sign. However, this is also performed to confirm CTS because the patient complains of tingling sensation, paresthesia, or pain in the area of the first digits and the radial half of the fourth digit in case if there is any median nerve compression, because median nerve runs in the carpal tunnel, so we can have an idea that whether there is some problem along its course or not. So to do a timeout test, the patient sits and tester taps the volar aspect of the patient's wrist over the area of the carpal tunnel. Here was the area shown in this diagram. Here. This is the core of the median nerve. So the tapping is being done here, to locate the median nerve and to sure whether the patient is suffering from CTS or not. The treatment of carpal tunnel syndrome includes the eliminators, which cause that pain. NSAIDs, the non-steroidal anti-inflammatory drugs, are prescribed as per recommendation, and cock-up bending in 0 to 20 degrees of extension, and then modified activity is also prescribed. Moreover, physical therapy is initiated 4 to 5 weeks after the onset of CTS. Progressive DROM activities, moreover, modalities are also prescribed if needed. And in case if the patient is not responding to the conservative treatment, so surgical release is an option. And patient with constant sensory loss, pain, and atrophy should also opt for surgery. Moreover, in surgery, the cutting of the transverse carpal ligaments is done to. That was a very short description about carpal tunnel syndrome. I hope all of you have an idea regarding it and it is clear.